Imagine the shock. You're in a public place and someone near you suddenly collapses. What do? This scenario, as frightening as it sounds, is not as uncommon as you might think. Every day, lives are unexpectedly thrown into disarray when a loved one, a colleague, or even a stranger suddenly falls unconscious. It's a moment that demands swift action and clear thinking, a moment where every second could mean the difference between life and death. Now you might be wondering, what role could I play in such a situation? After all, you're not a doctor or a nurse, right? But here's the truth. In those first crucial moments, you don't need a medical degree to make a difference. You, a bystander, could be the first responder, the first link in what we call the chain of survival. This chain begins with recognizing the emergency and calling for help, but it doesn't end there. It's about keeping the person alive until professional medical help arrives. In the case of a sudden cardiac arrest, this could involve performing cardiopulmonary resuscitation or CPR, something that anyone can learn and apply. The importance of immediate, effective bystander CPR cannot be overstated. It can double or even triple a victim's chance of survival. It's a skill that's not just for healthcare professionals, but for everyone. Because you never know when you might be the one closest to someone in their most desperate hour of need. So let's not underestimate the power of prompt action. Let's not shy away from the responsibility we all share to look out for one another, because in those terrifying moments when a heart stops beating, it's not just the medical professionals who can save a life. It's each and every one of us. Now that we've set the stage, we will walk you through the steps you should take in this situation. Before you spring into action, you need to recognize the signs of a possible cardiac arrest. It's not always as dramatic as it's portrayed in movies. Sometimes it can be subtle and easy to miss if you're not paying attention. Cardiac arrest usually begins with a sudden loss of responsiveness. The person will not respond to touch or sound. They may collapse or simply fall asleep, but when you try to rouse them, they won't react. This can be a frightening experience, and it's crucial to stay calm and focused. Next, check for a pulse. This can be done by placing 2 fingers on the neck, just below the jawline, on either side of the throat. You're feeling for a rhythmic throbbing under the skin. In the case of cardiac arrest, the pulse may be irregular or, in some cases, entirely absent. Now, pay attention to their breathing. Is it normal, or is it too fast or too slow? Are they struggling for breath, or does it seem like they're not breathing at all? Abnormal breathing patterns are another major sign of cardiac arrest. This could be agonal respiration, which is a series of gasps followed by periods of no breathing at all. You might also notice changes in their skin color. They may turn pale or blue, especially around the face, lips, and fingernails. This is due to lack of oxygen in the blood. It's important to note that these symptoms can appear in any order, or not at all. Each person's experience with cardiac arrest is unique. But here's the thing. Time is of the essence. Every second counts when someone's heart stops. Recognizing these signs quickly can make a profound difference in the outcome. So in summary, the key signs of cardiac arrest are a sudden loss of responsiveness, an irregular or absent pulse, abnormal breathing patterns, and changes in skin color. It's a lot to remember, but with awareness and practice, it will become second nature. Once you have recognized these symptoms, it's time to act. The first and foremost step is to call for professional medical help. In the face of a cardiac emergency, time is of the essence, and every second counts. Dialing your local emergency services number quickly can make the difference between life and death. When you connect with the dispatcher, stay calm and clear. Provide the necessary information, including your location and the nature of the emergency. If you've identified cardiac arrest, say so outright. This will help the dispatcher understand the urgency and dispatch the appropriate medical team. Remember, your words carry weight. Be specific about the symptoms you've observed. Is the person unconscious? Are they breathing? Have they collapsed? Your answers to these questions will guide the dispatcher in providing immediate advice while the medical team is en route. While you're on the line, follow any instructions given by the emergency services. They're trained to guide you through life-saving procedures over the phone. While help is on the way, there are life-saving measures you can take. Resuscitation can be a lifesaver. Here's how to begin. When a person's heart stops beating, every second counts. The first step in resuscitation is to ensure the person is lying flat on his or her back on a firm surface. This position allows for the most effective chest compressions. If the person is not on a firm surface, try to move them, but only if you can do so safely. Next, kneel beside the person, level with their chest, Place the heel of one hand on the center of the person's chest, right between the nipples. Put your other hand on top of the first, interlocking your fingers. Now, you're ready to begin chest compressions. Chest compressions are the cornerstone of resuscitation. They keep blood circulating through the body, delivering vital oxygen to the brain and other organs. To perform a chest compression, use your body weight to press down hard and fast on the person's chest. Aim for a depth of about 2 inches or 5 centimeters and a rate of 100 to 120 compressions per minute. That's almost 2 compressions every second. Remember, it's better to press too hard than not hard enough. Don't worry about causing harm. The risk of injury is much less than the risk of doing nothing. While you're doing chest compressions, try to keep your arms straight and don't lift your hands off the chest. This maintains the most consistent pressure. Perform 30 chest compressions. Then, if you're trained to do so, give 2 rescue breaths. If you're not trained, or if you're unsure, just continue with chest compressions. Chest compressions and rescue breaths should be done in cycles. 30 compressions, then 2 breaths, and repeat. Don't stop unless the person starts to show signs of life like breathing, coughing, or moving, or unless medical professionals take over. Resuscitation is an intense process, but it's also a crucial one. It's a skill that can truly be a lifesaver. After starting chest compressions, it's time to provide breaths. Breathing for someone in cardiac arrest can be vital. Here's how to do it. First, ensure you've positioned the individual on a flat surface, on their back, and you're kneeling beside them. You're going to need to tilt their head back and lift their chin to open the airway. Now take a brief moment to look, listen, and feel for any signs of normal breathing. If there's no sign of breath, it's time to step in. Start by pinching the individual's nose shut. You'll then need to take a normal breath and seal your lips around their mouth, creating an airtight seal. Now breathe out slowly, watching for the chest to rise. This should take about 1 second and should mimic a normal breath. Once you've done this, break the seal and let the chest fall back down naturally. This is what we call a rescue breath. The rescue breaths are important, but they're only part of the equation. They need to be paired with chest compressions to maximize their effectiveness. After giving 2 rescue breaths, immediately return to chest compressions. The rhythm you're aiming for is 30 compressions, followed by 2 rescue breaths. You'll want to maintain this rhythm without interruption until medical professionals arrive on the scene. Remember, time is of the essence in a cardiac arrest situation. Every minute that passes without resuscitation reduces the chance of survival by 7 to 10%. So maintaining this rhythm of compressions and rescue breaths is crucial. It's also worth noting that rescue breaths may not be possible in every situation. If you're uncomfortable, unable, or untrained to perform rescue breaths, focus on chest compressions. Continuous, high-quality chest compressions alone can also significantly improve the odds of survival. But if you can provide rescue breaths, do so. They can provide much-needed oxygen to the brain and other vital organs, buying precious time until medical professionals can take over. Continuing these steps can make a significant difference while waiting for medical professionals. When medical professionals arrive, it's time to step back. But what exactly happens when they do arrive? Well, the first thing to understand is that these individuals are trained for these exact situations. They're equipped with specialized knowledge and tools to handle emergencies such as a cardiac arrest. Their arrival signifies a critical shift in the resuscitation process. Once on the scene, the medical professionals will take over the resuscitation efforts. They might use an automated external defibrillator or AED to deliver a potentially life-saving shock to restart the heart. They may also administer medication to support the heart's function and improve the chances of survival. But their work is not just about the immediate treatment. Medical professionals also focus on stabilizing the patient for transport to the hospital. They make sure the patient's airway remains open, monitor vital signs, and prepare for any potential complications during the journey to the hospital. One of the key roles you play at this juncture is providing them with all the information they need about the incident. While they're focused on the patient, you can provide critical background information. What were the circumstances leading up to the collapse? How long has the person been unconscious? Has the person been given any medication? Are they allergic to anything? These details can influence the treatment strategy and help the medical professionals take the best course of action. Remember, these professionals are part of a larger healthcare system designed to respond to emergencies like this one. They're connected to hospitals where further treatment can be administered and where the person can be monitored until they're stable. The arrival of medical professionals is a beacon of hope in a tense situation. It's a moment where specialized help takes over, but it's also a moment that underscores the importance of the actions taken before they arrive. Your role in recognizing the problem, calling for help, and starting resuscitation can make a significant difference in the outcome. So, when medical professionals arrive, it's time to step back, but it's also time to help them help the patient. Resuscitation is a crucial skill that can save lives. And in those critical moments before help arrives, it might be up to you to start the process. So, to recap, what are the key points about resuscitation that we learned today? In this video, we've walked through the critical steps involved in resuscitation, particularly in the context of a cardiac arrest or asystole. We began with the unexpected collapse, a situation that can occur anytime, anywhere. Recognizing the signs of a cardiac arrest quickly is crucial. Unresponsiveness, abnormal breathing, and a lack of pulse are key indicators that something is seriously wrong. Once we've recognized the problem, we need to call for help immediately. Dialing your country's emergency number is the first step, but don't forget to alert nearby people as well. The more hands on deck, the better the chances of survival. The next step is to start chest compressions as soon as possible. For every minute without chest compressions, the chance of survival drops by 7 to 10%. So it's vital to start pushing hard and fast in the center of the chest, at a rate of 100 to 120 compressions per minute. Then, we discussed providing breaths, which can be done using mouth-to-mouth resuscitation or a barrier device. Providing 2 breaths after every 30 compressions can help deliver much-needed oxygen to the brain and other vital organs. We also touched on the arrival of medical professionals. Their role is crucial, but the actions taken before they arrive can often be the difference between life and death. That's why the role of bystanders is so important. Resuscitation is a process where every second counts. Quick action, familiarity with the steps of resuscitation, and the ability to stay calm under pressure can make a significant difference in the outcome of a cardiac arrest or asystole. In essence, the key points we've discussed are recognition, calling for help, starting chest compressions, providing breaths, and understanding the importance of the arrival of medical professionals. But remember, it's the immediate action taken by people on the scene that can truly save a life. Remember, your quick action can save a life. Stay informed, stay prepared,